My name is Jessica Loomer. I'm excited to talk through the community updates. Joining me on stage is Jerry Laurie, Lissa Poinsino, Melinda Marsh, I'm so sorry, and Chris Marsh. So thank you all for joining. We'll kind of kick it off. There are a lot of pillars and a lot of progress that's been made with LHON Collective. Amongst the various pillars, I will be talking about the community update and what we're a part of, which is the community. Up on the slide here is multiple pillars, and there are different things that we'll be talking throughout the entire session that we'll be able to share, whether it's education, outreach, financial support. I specifically will be talking about the community. We're here today at conference. I just want to take a moment for us all to take 5 seconds and look around. We're all traveled from near and far, and there's so much today that we'll learn from each other. In addition to being at conference here, there's so much resources that are still online from past conferences. So please take the time, soak it in, take a minute and really embrace this because it's really a fantastic opportunity. Conference is so important to us. But from conference, unfortunately, we all have to go back home at the end of the weekend, and there's much more resources after this. And a huge community is outside of this. I'm super proud to be part of this group, and there's leaders all throughout the conference here, but all throughout the country as well. We host various Zoom events that happen monthly. I host the LH1 live call that's gone on for, I think, 13 years at this point, once a month on the first Wednesday of every month. But there are so many other calls that happen, whether it's spouses or a regional call or employment or education. There's so many calls that hopefully you can find a spot where you feel most comfortable and you can find your own community there. The LH1 live call is actually a general call, so it's kind of a great first stop. I do want to take a moment to shout out to our leaders. There are multiple people all throughout our community that take time every single month to be able to participate, host, and moderate calls. These people couldn't make anything of this happen without them. So huge thank you to all of them. It's absolutely fantastic to have them. There's a couple of resources that are here on the slide. And let me tell you, amongst this entire presentation, we have a lot of QR codes. So get your phones ready and kind of buckle in to start taking a lot of these pictures because there's a lot of resources. And so it'll be jam-packed. So the first QR code on here is actually will take you to the LH1 calendar. This one specifically on the East Coast, so kind of just be aware to adjust it, but it does have every single call for the rest of the year. We actually plan the entire year for all calls in December, so we are totally ready for the next year. So it's pretty exciting. Again, thanks to the volunteers and commitment there. And so from there, I'll actually turn it to Jerry.
Good morning. As Jessica mentioned, my name is Jerry Laurie, and I'll be talking a little bit about the education piece of the LHON Collective. With the education piece, we try to develop and share educational information about LHON. So my first slide references the mental health booklet. It'll be discussed later, and it was mentioned a little bit earlier. So I'm not going to go into any great detail, although if you'd like to access it, the QR code is up on the screen. From an educational standpoint, the mental health booklet is one of the more interesting projects we've done because it reminds us that education is multifaceted. In most cases, we think of it as consolidating information from experts to write booklets or handouts that help inform the community about topics of interest or concern. The mental health booklet was actually the absolute reverse. The community, and many of you out there, provided information and education to healthcare professionals. So we were educating them. Many of you were interviewed, and that information became the mental health booklet. It turns out there's a real appetite on the behalf of researchers and mental health professionals for this information. I was fortunate enough to attend NANOS, the North American Neuro-Ophthalmologist Society conference early in the year, where Melinda presented a poster on the mental health booklet. And I can tell you the information contained within it was very well received. So if you ever think that your opinion doesn't matter or you don't have anything to say, please think again. My next slide takes the more traditional route of documents providing information to our LHON community itself. I'm talking about the state-specific financial guides that provide free or low-cost services for people who are blind or have low vision. It's a bit of a passion project for me, as I've been writing them since we received our first grant. They've been mentioned at conferences before, originally in 2020, when we completed the very first guide. It was 32 pages long and referenced California, since the 3 people on the team creating them were all from California, myself included. So we had the insider's view of the services California provides. We've since discovered that it's always good to have a draft version of any guide reviewed by someone in the community who lives in that state to ensure we don't miss anything. We've currently completed 11 additional guides: Georgia, Illinois, Kansas, Massachusetts, Missouri, Ohio, Oregon, Texas, Washington, and a generic guide that talks about mostly federal programs because they apply to the entire country. Additionally, we have 8 more guides in production: Florida, Indiana, New York, North Carolina, Pennsylvania, a generic Spanish version, and both an English and Spanish generic audio version. That's a big new change for us. When writing the first few, we quickly discovered states vary greatly in the goods and services they offer, which equated to a significant amount of research and research time in the creation of each guide. That meant that progress was pretty slow until about a year ago, when we were fortunate enough to be offered the volunteer services of a group of students currently led by Tim Tyson, who you may have had a chance to meet. We are thrilled to have him here as our intern, but he still needs to spend his time on my guides. The students are all part of the Bowler-Parsegian Center for Rare and Neglected Disease at University of Notre Dame, and they are researching the states so fast that I can barely keep up. That is a very good problem to have. The interesting thing about the project is that every time we finish a state, we find some new service that we weren't aware of, so the guides continue to grow and evolve. I mentioned that the first California guide was 32 pages long. Most of the guides now average between 40 and 45 pages. If you're interested in the guides, they're available on the website at LHON.org. If you don't see your state on the list, there's an easy way to move it to the top. Volunteer to be our reviewer. I've had a little more to discuss later on education, but for now, let's hear from the science bubble.
So speaking about science, one of the core missions of the LHON community is to advance the science. And no one cares more about getting to solutions than those of us in the LHON community, but not all of us were trained in science, have familiarity with it. But we can become citizen scientists. And by doing so, we can influence the pace of innovation and learning about LHON. And if you want to think about if and how you can get involved, there are ways. Since last year's community update, many people have gotten involved in many valuable ways, and you can too. One way to be involved began in 2019 when a group of us who are interested in keeping current on the LHON medical literature started getting together monthly just to discuss articles that we've read and scientific posters we've seen. Since last year's LHON community update, where Linda talked quite nicely about what the group does. The group has added several members, and we've discussed over 60 articles in the past year. And we ask each other questions, and we learn from what others notice in each article. And we become more knowledgeable overall about the science of LHON. And we bring that knowledge to the various Zoom events that we're attending. We bring that knowledge to conversations at this conference. We contribute to Facebook discussions with a little bit better awareness. Several folks in the room now do participate in that group. I'm not sure if I'm going to get everyone offhand, but Melinda and Chris are part of it. Paul, if you want to just raise your hand. Patrick is here. Linda McCardle, Lindsay Zibanowski, Danny's been a part of it. And it's fun, and you come when you can, and you don't when you can't. And we all just get just a little bit smarter about it. And any of us would be happy to tell you about it if you'd like to ask.
So I'm continuing on. This is Melinda Marsh with the science topic. And What we have up on the screen is called Developing Scientific Healthcare Articles, and everyone in this room has a superpower. And we are all here because we care about the LHON community and about scientific progress to benefit LHON. This slide is about an individual named Amy Koch, and I'd like to share with you how Amy took her superpower and found out last year, after she found out last year, that her daughter was diagnosed with LHON. Like most, if not all of us in this room, she then learned that LHON was a family affair. She came to her first conference to learn more and become more involved in ways she could be additive to make a positive impact for LHON. I would be having her present this slide and share how she wanted to activate her superpower, but she is unable to make it this year to our conference because she's currently at a different conference being inducted as a fellow into the American Association of Nurse Practitioners, which is a very important recognition in her professional field. So since this is recorded, let's all give her a round of applause. Congratulations to Amy. So what Amy did after she got back to North Carolina, where she works as an associate professor at Duke University, she began a deep dive into the medical literature on LHON and quickly realized that, like many rare diseases, there wasn't a lot published that she could reference on the lived experience of those with LHON. She felt with her background and training that this was a unique opportunity where she could bring more recognition to the medical community about LHON and about how we, the patient community, have interacted both positively and negatively with medical providers since our LHON diagnoses. There is a go-to place that scientists and medical professionals go for information in the fields of biomedicine and health sciences, as it offers access to a vast collection of research articles and other relevant materials. It is called PubMed. Amy began to work on papers to be published in this field to improve the lived experience of those with LHON and their interactions with healthcare providers by identifying what has worked and what has not worked. She conducted focus groups to gather information and has now written articles to grow the searchable PubMed database and how the medical community can improve the diagnostic journey and continued care of those of us with LHON. This great work was all done and is continuing to be done by someone who recently joined our LHON community. And she saw a need and she wanted to address it. If you are interested in working alongside Amy on future articles for medical journals, please talk to me during this conference or after, and let's connect to have a larger team to further this work and how it may be impactful going forward. On a broader note, this is not unique to only the writing of medical journal articles. It is an example of how one individual in our LHON community saw a need, identified her superpower, and connected the two to benefit all of us with LHON. So I invite you to consider, what is your superpower and how can we work together for the benefit of our LHON community as a whole? So the next slide is talking about those scientific posters that Jerry referenced. Before I learned about LHON, Lissa has been exhibiting at annual meetings where medical professionals focused on neuro-ophthalmology gathered, such as the North American Neuro-Ophthalmology Society, also known as NANOS, to both raise awareness of LHON and the LHON community among neuro-ophthalmologists, as well as to provide opportunities to discuss LHON research with the researchers actually conducting the work that will benefit LHON. This work continues, and these connection points are also an opportunity for us within LHON Collective to bring awareness to the medical community through scientific posters that we present on topics such as the data collection program and our new mental health booklet, so that these opportunities are learned and then used by those same neuro-ophthalmologists and other medical professionals. And then as they're utilized better, we all benefit as a community as a whole. We're going to go on to the next slide, and I'd like to talk about Combined Brain, RareX, and the Harvard Brain Tissue Resource Center. This is a lot to talk about, and I have 2 minutes. So what I'm going to do as an invitation here is, instead of trying to cover all 3 of these topics in a comprehensive manner, I'm going to ask that we all are active partners together. And the conversation, since it's longer than that 2 minutes, is that we start and end with, let's meet. Let's have an individual meeting where you and I find 30 minutes of time outside of the conference where I can highlight and figure out best ways you can engage and be an important part of how we work together to move the science forward towards breakthroughs for LHON. The 3 items we will talk about include RareX, as I mentioned, and combined brain, and then the HBTRC. RareX is our medical registry where we have over 250 participants globally. And honestly, we need a whole lot more. We need 1,000 carriers and affected individuals to participate so that the researchers will engage with us and have greater interest in LHON and in the medical data that we're providing. If you haven't participated, we need you to do so. If you have, there are important new questionnaires that are LHON specific that we need to go back in and complete. Combined brain is the next topic I'd like to talk about. This is an opportunity to collect tissue, blood, and other samples. So we have an LHON biorepository that is ready for researchers to access to move the science forward more rapidly. Rather than gathering these samples when the need arises, let's be on top of it and ready for the request for these samples prior to the request coming to move the science and medical advances forward for LHON. Lastly, the HBTRC is an opportunity for those of us who are carriers and affected to be able to designate our eyes, optic nerve, and brain for study purposes upon our passing. Animal models are useful, but an actual human tissue is imperative to really understand what is going on with LHON and how to best address medical approaches to fix it. Please stop by and see me during our coffee and conversation, and let's figure out a time that works in both of our schedules after conference to dive more deeply into all 3 of these topics and where you would like to be a part of the solution for LHON.
So a lot of opportunities to be involved, to get involved, to even think about how we can each contribute our personal story, our personal experiences, and even parts of our body into this whole scientific endeavor. Rare is often defined or plagued by a feeling of scarcity. That's in the name. But what I would offer to you is we're here at UMDF, and much of the recent research is suggesting we are number 1 or number 2 most prevalent mitochondrial condition out there. Rare is not so rare when you think about things in a broader perspective. And what I want to invite you to consider is that what we're also building is an ecosystem, a network of people that you may be connected to, who may have other ideas and answers for part of the science to move forward, or they may be connected to somebody else. But what we're building is something way bigger. And so we're fortunate to be a rare disease, but also with a really growing body of people who are offering their insights and their expertise. So we're pleased to launch a video that, with any luck, our AV team are going to be able to start to play now that will allow us to hear from some of these
LHON. In this video, you'll be hearing from leading LHON experts. Their shared mission? To accelerate progress toward treatments and ultimately a cure. Because breakthroughs don't happen alone. They happen when we come to the table, together. Dr. Alfredo Sadun.
In the field of LHON, there are about 3 really key questions. The first is, how does it start off happening anatomically? What is the real physics behind it?
Dr. Ann Chiaramello.
My second fundamental question will be to determine the pathogenic mechanism that is responsible for converting the carrier from asymptomatic to symptomatic.
Dr. Javier Loria.
The next question would be, what are the predictors? Predictors of conversion, predictors of severity, evolution, etc., and also what are the predictors of recovery or improvement.
Dr. Caitlin Barrett.
It's so critically important in a rare disease to have the data, because the more data you have, the better you understand the disease. And I think that if we try to approach therapeutic development without understanding some of these basic pieces, then we're only setting ourselves up for challenges.
Dr. Marnie Falk.
So there is no such thing as one type of levers, right? It's all really quite a spectrum. And so I think for each person, we have to respect that they're an individual, and we need to understand them. We need to understand their mutation, their heteroplasmy level, in their tissues, in their ethnic background, in in their family background, in their lifestyle. And sometimes in LHON, you can have the errors in the genes and never develop a health problem. So what are the stressors that elicit the health problem? Is it aging? Is it exposures to things like smoking or alcohol or toxins in the environment? Is it medications? Is it illness? If you have models, you can test these things and start to see what you could do to protect people, what advice you could give, better medical guidance to prevent them from losing their vision. Because we know of a whole lot more carriers of these diseases than we know of affected people. And we don't know exactly what to tell people to prevent them from going blind. So I think the field's at a place where not only can models be created, they should be created, and they should be shared.
But the best part isn't just that we can diagnose it correctly or even initiate the right management. It's that we can talk to patients and give them a real good sense of how it's going to go. And our own studies have shown that the neuro-ophthalmologists, when they are part of the support service for patients, the depression levels are much less.
LHON originally was vision loss. And the symptoms, the plus symptoms, the additional symptoms, can be neurological, can be cardiac, can be gastrointestinal, and anxiety, migraines, seizures, very serious symptoms.
And it may be fine now, but it may develop. If we're not looking, we don't know.
Setting better expectations to how we measure things. We tend to measure things in terms of visual acuity and improving visual acuity, etc., fine. But I mean, a patient might be looking at another way of improvement. So not whether I see sharper or not sharper, I just want to see wider and I want to see a better field. You guys have information which you think it's not important because you are not physicians, etc., but it's absolutely crucial. So get that information out in the sense of don't be shy to speak. Don't be shy to speak to your physician. Don't be shy to put that data into a registry or databases, etc. Everything is important. Nothing is something that you can ignore.
The data, the samples, those are really critical. From those, you can start to understand the disease, and then you can start saying, okay, we have some patient tissues, let's make organoids out of them. Let's make animal models now that we understand some of the other genetic components that are involved in this particular disease. You understand the disease, you understand the cells that it's impacting, and you're able to say, okay, I see a real big opportunity to address this particular pathway within this disease, and we know there are drugs that are already out there for it. That's we're in a great time right now because there are therapeutics all over the place that are doing so many things, and repurposing has a lot of potential as well. Let's get other organizations that work on mitochondrial disease that want to better understand their disease. Let's get together funders with LHON and let's activate them on a single priority that we know is going to make an impact. Research is not cheap. And I think that it's really critical that when there is the opportunity to collaborate at the funding level, we do it.
Some of the science leads to some clear-cut clinical approaches. We are really good at collaborating. But if instead you say, are we making inroads in terms of modulating the extent of the disease, or controlling the number of people who lose vision, or managing it in a better way? Absolutely. Every year we're a little bit better off.
So that's why you really do need to have a community, and that's what's so amazing about the LHON Collective, is that it's really trying to get the right people in the room from the beginning so that at the end, there's no surprises, right? You've known the regulatory steps, you have the data in a compliant format, you've had the right people get together, and you've had buy-in between the people who are going to be treating the patients and the people developing the models, and you've taken sort of an unbiased approach to understand how to communicate and gather that information. So I'm very hopeful that there's going to be therapies for Leber's hereditary optic neuropathy, but I don't think it's going to be one person doing it or one group doing it. I think it's going to be people that really listen to what the patients need, engage the patients in the process, and I think by doing this and creating awareness of what everybody's doing and not to have to repeat things, but to share the information and the learning, things are going to leapfrog. And I think therapies will be here much faster by working together.
Javier Loria, MD, Medical Lead, Rare Diseases, EU and Emerging Markets, KAC Global Rare Diseases. Anne Chiaramello, PhD, Professor of Anatomy and Regenerative Biology, Founding Director of Mitoepigen Program, George Washington University School of Medicine and Health Sciences. Caitlin Barrett, PhD, Director, Milken Institute Science Philanthropy Accelerator for Research Collaboration, or SPARC, Rare Disease and Oncology. Alfredo A. Sadoun, MD, PhD, Chief of Ophthalmology, Doheny Eye Centers, UCLA, Vice Chair of Ophthalmology, UCLA, Thornton Professor of Neuroscience, UCLA. Marnie Falk, MD, Executive Director and Clinical Geneticist, Mitochondrial Medicine, Frontier Program, Children's Hospital of Philadelphia, Professor, Department of Pediatrics, University of Pennsylvania, Perelman School of Medicine. Your voice and participation matter as we work together towards a cure for LHON. Visit our website to learn more about how we can make a difference. LHON.org.
So just a brief comment. It's rather uncomfortable for me to listen to this one because it's my brother's voice who's doing the voiceover, and it wasn't my idea to engage him. It was Melinda, so I give her full credit. But I think this is maybe an example. We all have amazing superpowers, as Melinda alluded to, in this room and beyond. And when we think about different strengths that can come together, even a voiceover, it's kind of fun to sort of see what we can do in strengthening this community, strengthening our message, and strengthening our collective voice. So what I hope you'll take away is that we're launching that scientific video today in response to some things we talked about last year about where are we going on this dual-pronged mission of strengthening our community and advancing the science. And Melissa alluded to this earlier. This video will get posted up onto the website. We will be circulating that. Jessica, you alluded to QR codes. I just didn't think to have a QR code right at the end of that video. Doggone it. But I hope if you took away anything from that video, one, it's that this cumulative body of interested scientists, researchers, incredible clinicians that we're really fortunate to interact with, and many of you have engaged with various among them, but also an increasing number of industry partners, including some in this room that you'll meet over the course of the rest of the conference. And how we think about these different strengths coming together, how we think about where the gaps are, needs a strategic roadmap. And so we're going to talk a little bit about what that roadmap looks like. You heard Caitlin Barrett referenced on the video. You're going to hear from this afternoon Nadia Penrod as a part of our Science Moving Forward panel. They both are colleagues at the Milken SPARC group. And the Milken Institute has been our partner for the last 18 months building this scientific roadmap and strategy. Up on screen is a simple one-page overview of what we've tried to navigate over those 18 months. On the left-hand side, there is a landscape analysis referenced. And really what I would synthesize this down to is a cumulative set of interviews to say interviewing 80 plus different constituents across these different groups. So researchers, clinicians, scientists, and various who knew LHON, and a whole lot, probably half the group that didn't really know as much about LHON, but knew other mechanisms, other delivery modalities, other new scientific therapeutic approaches. And specifically, we wanted to talk about where's the puck going as it relates to this science. That landscape analysis has now been published, a 25 plus page report called the LHON State of the Science. That also is available to you to share with others or to go through at your, as you see appropriate. And yes, as Lissa alluded to, we've even plugged it into the science team monthly conversations. What I'll encourage you to think about that State of the Science as a cumulative body of knowledge of all that we know after decades of research on LHON up until this point. And just as importantly, what does that suggest are the next set of questions we really need to dive into? So last February, we got about 25 of those leading minds together in Lisbon, Portugal for the first ever deep dive LHON scientific retreat. And again, I want to express my sincere thanks to Nadia and Caitlin and their colleague, Kara, who helped from the Milken Institute perspective facilitate a scientific dialogue among these thought leaders around the globe. Every region of the world was represented in this room, including a whole host of others that weren't able to travel to Portugal, but would come in via video conference and offer some insights. to watch questions, ideas be proposed, and even those that have been researched but not published be able to be shared in a closed door session like that. To quote one of our leading clinical researchers, she said, "I'm so glad I asked the question and you answered. You just saved me a year's worth of work that would have been spent doing something that probably didn't need to be retread." So this scientific retreat resulted in an opportunity map. And this was kind of referenced in the video, but how do we really start to zero in on a few key priorities? Yes, it's hard to drive funding in the world of rare diseases, but it's not impossible if we know what we're going after. And so we'll talk a little bit more about this opportunity map this afternoon, but there were 5 key areas that really emerged as the core priority gaps and opportunities. And that gives us a means to really start to think very carefully about what are we funding, what are we really trying to activate, and how do we bring these different constituent groups together. And then the last component that's referenced on this slide on the right-hand side is what we're going to start in the second half of this year. And it's called a research working group, a resource research working group, RWG. I'll get that acronym right eventually. We'll unpack this a little bit in greater detail, but I want you to think about it as a means where we can transition this knowledge from those who have really spent the greatest amount of time in here in LHON to those who also are coming in from an outside perspective and may offer some really interesting breakthroughs. So what I want you to take away from that is that we've got a real strategy that's starting to emerge here on how to advance the science. And if I recall correctly, that leads into the next of Jessica's pillar references here, which is going global. Just briefly, I'll mention that anybody who's followed science and health research in the United States over the last several months knows that things have fundamentally changed. NIH has been massively disrupted. Traditional funding models have completely been upended. We're not going to get paralyzed by change. What we are doing is what we should always be thinking about. Rare disease doesn't know borders, neither should our thinking and where we look for new breakthroughs. Going global is an imperative part of how do we think as an LHON collective group across the globe. And I won't try to take you through all of these photos, but I would just simply share with you that we are actively trying to represent you. And if you are going to be going global, we want to work with you to make sure that we're really representing a strong LHON voice in every opportunity around the globe to tap into researchers and to be recruiting talent, recruiting capital that might be deployed on a variety of different fronts. But if it's LHON relevant or has the potential to be, we want to find ways to tie into that. So I won't take you through all the screens here, but know that these slides will be available to you. You'll see some fun smiles that are up there. You'll see a picture of the House of Lords where our friends over in London last month cut a ribbon on a brand new LifeArc Center for Rare Mitochondrial Disease Research. Again, it's all rare, but things are starting to open up and new possibilities there. And you'll also see some references to many of the clinicians you just saw in the video coming together a few weeks ago in Salt Lake City alongside the ARVO conference, the Association for Research in Vision and Ophthalmology, and having a dedicated multi-hour LHON luncheon to really kind of talk about where our different research is showing various areas of promise and how do we transition that knowledge as effectively as possible. So I'll leave the global comments there, but you'll hear a lot more this afternoon when we talk about the science moving forward. Jerry?
Okay, back to me. I'll apologize for the coughing. My asthma is acting up a little, but I'm doing the best I can. So I'm going to discuss the pillar that we refer to as organization. What actually is the LHON Collective? We've had an LHON community since Lissa pretty much created it many years ago, but it was loosely formed group and didn't have a true structure. And that made it hard to move forward with different initiatives. That changed in 2022 when LHON Collective was created and became an official 501c3 charitable organization. But what does that mean? What are we trying to do? Those answers can be found in our mission statement, which is up on the screen. It states, LHON Collective is a global initiative dedicated to accelerating progress towards a cure for Leber's hereditary optic neuropathy while improving the lives of people living with LHON. Those are lofty, but not unattainable goals. However, creating a structure is not enough to move ourselves forward. We still need to recognize the amazing work that has been done over the years, but still be flexible enough to change and grow. We've been working on several projects designed with that growth in mind. Lissa, would you like to describe the first one?
Absolutely. So back in 2009, when my son Jeremy was diagnosed, my friend created the logo that you see on screen now that you're familiar with, that's on LHON.org. And the intent was for the red O to really stand out against the dark black, to really communicate the abrupt nature of vision loss that happens with LHON. And clearly the I suggests that it's an eye disorder. And I couldn't remember what the LHON stood for, so we put the whole name underneath. And that logo has sort of followed me around, or I've pushed it forward over many, many years, taken it to conferences and met a lot of people, and people have seen the site, and it's, well, kind of, you know, in our small community, it's gotten well known. And since Chris, Melinda, and I co-created LHON Collective, we've been talking about the need to develop a logo that communicates that we're actually now an organization, and it has a name, yet infusing it with the 16-year history and awareness and trust associated with the current logo. And I'm excited to show you that the team has very recently finalized what I think is an amazing choice, which is the new LHON Collective logo. And it includes the organization's name. We wanted to include the labor hereditary optic neuropathy, but by now many of us have learned to say it, and we kind of couldn't fit all the words and make it look good. So we think the I is communicating that it is an optic issue. When we created the first logo, I didn't know that people affected by LHON couldn't see red. I didn't know that the blue that I'm wearing today is LHON neon blue, but now we know. So we clearly infused the logo with LHON blue. And there's been special attention made to make sure that the typeface is, you know, clear and visible. So that is our new logo, which will be part of
Our new look and feel, which is reflected up on the screen. It's not limited to the logo. One of the most important educational tools we have is the LHON.org website, where there is a wealth of information available from the basics of LHON to first steps to take upon a diagnosis to how to live your best life with LHON. A small group of us have been working very diligently to also update the look and feel of the website. It's a challenging task. Its time had come. The original LHON website is where most of us found the bulk of what we know about LHON. So it's important not to lose valuable content, but instead to update the information, remove any obsolete or redundant data, and also take advantage of accessibility tools and features that were not available when the original website was created. In addition, we want a more professional look that highlights the people in our community and that will assist in attracting potential funders, while never forgetting that at its heart, the website is the most important educational tool in our arsenal. When it rolls out, we hope you'll find it easy to use, and you might even see yourself on one of the pages. So my final slide. At the last conference, we talked about our plans to build a community connection database. This is a separate database from the ones that have been mentioned earlier. The idea is to get contact information for everyone, and by everyone, I mean worldwide in the LHON community who want to participate. It wouldn't be used by doctors or researchers, but instead by our own people, so we can connect you to one another. There are different questions for you to answer depending on whether you're affected or a carrier or a friend or family member. We rolled it out in a beta format at the last conference. The tool we are using is actually called Salesforce. We were ready to go live when a discussion of whether or not we needed to be HIPAA compliant came up. The front-end website we were using was secure, and Salesforce itself is secure, but there was a discussion as to whether the tool was getting the data that we were using to get the data from the front end of Salesforce, or from the front end to Salesforce, was HIPAA compliant. The movement between the two is called data in transit, and the software we were planning to use did not have a signed HIPAA agreement with Salesforce. Conversations with various legal advisors essentially said we didn't need one. However, I'm very proud to say that we decided that since we were still in the beginning stages of the project, it made more sense for us to overachieve and set ourselves up for the future in as secure a methodology as we could. That meant we had to back up, find a different tool, reprogram with that tool. And we did. We found a different tool. We did reprogram, and the tool we selected is not only HIPAA compliant, but I'm happy to say it's also ADA compliant. So we feel we definitely made the right decision there. If you worked with us at the last conference, your data went straight into Salesforce, so it was never a problem, and it's still there. You don't need to re-enter it. If this is your first conference, or you didn't have time to sit with me last year, we'd love for you to become a part of this initiative. On the screen, there's a sample of the first form that gets your initial information into the system. It's very simple. We ask for your name, your email address, what country you live in, your zip code, whether you're affected, a carrier, or a friend or family member, and then you check the box that says you're over 18 or 13, excuse me. That's all there is. If you click on the QR code, you can fill it in right now. It's live. Or if you're not comfortable, you can sit with me or Tim or Nancy Holmes, another member of our Salesforce team who will be with me at Coffee and Conversation, and we can do it together. Once you enter this info, you'll get a follow-on email with questions specific to whichever box you checked. If you can't remember if you did it last year or not, just come and see me and I'll look you up in Salesforce. I'm now done talking. Melinda.
Thank you, Jerry. So the next topic is on collaborations. I used to say that as LHON, we straddle this fence. On the one side is a vision loss issue, and on the other side of the fence is a MITO issue. Well, the more I learn, the more I see that LHON is more like that point in the United States called the Four Corners, where 4 states meet at a single point. 2 of those points are still the vision loss and the mitochondrial focus, and 2 others that have great importance, and we need to recognize their importance, are the grouping of rare diseases in general, because together as rare diseases, using our voices to amplify shared values, we are important and not rare. And the last touch point of these 4 intersections is genetic disorders. While LHON is a vision disorder, that's mitochondrial in nature. It's also a genetic disorder that aligns us with 10,000 genetic disorders and the group that serve them. So let's dive a little more deeply into how we are working to be in all 4 of these corners and add value. The first slide that comes up is on vision loss and the aspect of LHON and how we interact with some of the organizations that benefit our vision loss component of our disease. Many in the LHON community benefit from connecting with one of the groups focused on blindness, such as ACB, AFB, or NFB. Some attend conferences and exhibit halls with assistive tech, such as CSUN. The Foundation Fighting Blindness has resources such as their new mental health materials that can be found valuable to those in the LHON community. We've also been working closely with Global Genes, with their department underneath called RareX and Carmen Trupek, to develop a vision consortium of rare genetic vision disorder patient advocacy groups. We're called PAGs. LHON Collective is one of them. And it's gotten so active that we now have a research group that includes Paul Laurie, Chris Marsh, and an advocacy working group with Maria Johnson and myself. And Lissa, true to form, has chosen to attend both. This vision consortium had a booth at ARVO. It's the world's largest convening of researchers working on vision research. And we hosted a reception that convened many folks working on LHON and other ocular disorders as patients, researchers, and biopharma. Now we're going on to the second of those 4 pillars that we discussed, and this is the mitochondrial disease grouping. Since LHON is a mitochondrial disease, we connect with a number of organizations around the world dedicated to mito. For example, as a mito disease, we've had LHON-specific content at the UMDF MitoMed conference since 2013. Which attracts all of you as the largest convening of the LHON community. Sean Murray The CEO of Australia's Mito Foundation is one of the speakers this afternoon on our LHON Science Moving Forward session. Another organization called Mito Action offers programs of interest to the LHON community, including its monthly Wondering Wednesdays, where you can ask questions to a genetic counselor at no cost. Mito Action also has a podcast, and they interviewed Lissa and myself about LHON Collective. Their CEO, Kyra Mann, is a chair of an organization called International Mito Patients, or IMP, based in Europe, and they host an LHON Awareness Day webinar every fall. The third of this grouping is from our four corners, is called genetic disorders. As I said earlier, LHON is also a genetic disorder that aligns us with 10,000 other genetic disorders and the groups that serve them. One organization, Global Genes, brings together over 800 PAGs in their Global Advocacy Alliance. Last fall, Jessica Loomer, John Coughlin, Chris Marsh, and Lissa Poinsano attended their annual summit, where they learned best practices in patient advocacy. This year, Global Genes is providing its training via online sessions, and if there is a topic that is of interest, it is open to anyone to attend and learn more. NSGC is the National Society of Genetic Counselors, and LH1 Collective strives to remain connected to them and their resources so we can support our LH1 families seeking genetic testing and counseling. Lastly, LH1 is also a rare disease, which connects us with organizations with that focus. One example of how we work with those interested in rare diseases is our connection to Notre Dame's Rare Disease Minor. Many of you have had the opportunity to meet Tim Tyson, and if you haven't yet, I recommend you do so. We're very lucky that he is currently our intern from the Notre Dame program for the summer, and to have his help as it's making us more productive and able to serve our LH1 community that much better, as well as pursue some of the scientific and education opportunities that we might forego without his help. I'd also like to highlight a rare disease organization who will be representing a panel tomorrow called Every Life Foundation for Rare Diseases. They work with rare disease groups such as LHON to be better advocates for research and support for LHON and other rare diseases. We're moving on from this section to the second to last, called fundraising. And I'd like to introduce Uli Heine, who will also be speaking tomorrow about fundraising and LH1 Collective. Uli is in the back of the room wearing a gold-colored jacket and top. And Uli, if you could please stand and please wave. Thank you so much. I am really looking forward to her presentation tomorrow. And if you would like to talk to her further about support for LH1 and science, as well as community support, you can connect with her at the coffee and conversation timeframe tomorrow morning or anytime today. The next topic, within this is the fundraising, and I'd like to share with you some of the initiatives where LH1 Collective has been fundraising recently that you may or may not be aware of. On the screen is a picture of our website where different types of donations can be made. You would navigate to lh1.org and then to the Get Involved tab, and it's at the top of the screen. The middle of this slide referenced our Yeti Cup fundraiser, where people in our LH1 community donated $150 or more. And as a thank you, we provided a Yeti Cup to raise funds for this conference. I would like to say a personal thank you to many of you in this room who participated. We are still fundraising to cover the conference costs, and if you would like to support the conference financial needs, there are cups left, and please see me. Lastly, on the slide, there are events that people in our community hosted to raise funds to benefit LHON, including sporting events, as well as dining in the dark type of events. We will have a session tomorrow where our LHON friends who have had hosted an event to benefit LHON will share what they did and how it worked, in case anyone is interested and would like to follow up with them individually. Another way to raise funds outside of these direct donations and events is to write grant applications. I'd like to recognize a few organizations who have supported LH1 Collective over the last calendar year. Global Genes provided us a grant to create the mental health booklet that we will talk about in further detail later today. Other grant support is helping us to host this conference for all of us right now. We'd like to thank Chiesi as the major funder who made this meeting truly possible. And in addition, we'd like to thank Blue Oak Nutraceuticals for their support and Delta Gamma, who has supported the conference for over a decade. Sometimes when you write a grant request, companies give you something other than money. This came as a great surprise to me. In one case this year, two blind brothers wanted to support our conference but couldn't provide funding. So what they provided was a gift in kind, which in this case was a product. They sent me 150 pairs of socks. Two blind brothers socks, to be exact. So I have a pair of socks for everyone who is attending the conference. Please stop by and see me tomorrow at the Coffee and Conversation. And I will give you your pair of socks and you will trade me 30 minutes of time on a calendar for the future. John Coughlin and I have been working to write these grants, and I'm referring to, and we are also always looking for more grant writers to help us to expand our capabilities. If you might be interested in joining our motley crew of grant writing, we'd love to have you. I'm now passing this on to Jessica to return to the topic of community connections.
Thank you, Melinda. Is everyone just pumped by all this information? Like, holy cow. So when I get excited, I volunteer. And so bringing it back to community and volunteer, there's so much to do here. There's so much opportunity, so much progress has been made, but we can't do it alone. Melinda, walk me through some opportunities. What could I do if I was in the crowd and wanted to volunteer?
I would love to do that. Thank you so much. And let me point out, if any of these opportunities that I walk you through really quickly really resonate with you and you'd like to talk further about them, Jessica will be at the Coffee and Conversation tomorrow morning to discuss further any of the opportunities that we're listing. The first category is called communications, and underneath that is community education that Jerry mentioned, social media, graphic design, newsletters and email blasts, and a website management. Then the next section is called community outreach and engagement, and that's something that Jessica is intimately involved in. And beyond that is development, and development is at its core fundraising and grant writing. And then we have events, such as the conference right here, right now, that we're all enjoying and benefiting from. Project management, online events coordination. The second half of this column talks about LH1 outreach. Those are LH1 ambassadors, patient advocacy group relations, global relations. We want to maintain those relationships, grow those relationships, and become that much more impactful. Medical and science advocacy, there's two sides to that type of advocacy, the medical half and the science half, and they sometimes meet and intertwine and sometimes are very differentiated. And the last grouping is called operations. And within operations, as unexciting as operations sounds, it's still a very necessary part of any organization. And it includes everything from our community connections database. That's that Salesforce that Jerry was referring to earlier. It's our data collection program, which is the medical registry that I was speaking about. Data protection, technology, budget and finance topics, and volunteer management. If we're going to do this and keep our costs as low as possible so that we can donate as much as possible to future science opportunities, we need as many volunteers as possible. Thanks, Jessica.
Thanks, Linda. Couldn't that call to action couldn't be stronger. And so I'm really excited to be joining the tables at Coffee and Conversation. Like Melinda said, please stop by, come visit, and we'll make sure we get you signed up. So speaking of conference, let's kind of look ahead. Just for 2026, Lisa, kind of walk me through what can we expect for 2026?
So earlier this year, the LHON conference planning team sent an email, and hopefully you're all on the email distribution list, and hopefully you all got the email and read the email. And in it, we explained that we were surprised when the UMDF informed us that they had decided not to collaborate with us on an LHON conference at MitoMed next year in 2026. But though there won't be any LHON vision specific sessions, the new CEO who will be meeting with us tomorrow, she has assured us that LHON families are absolutely welcome to attend. And the LHON conference planning team has committed to attending so that we can be there to facilitate connections among folks in the LHON community who do choose to attend. And that will generally be folks who are very interested in LHON plus and sort of the crossover with mitochondrial disease in general. And so it will be in Orlando, June 18 through 20. And if you haven't already figured out, when this group gets together, we have fun. And there's no way to get a group of any size together in Orlando and not have some fun. So we sort of expect that when we get back together as a conference planning team after this event, which has sort of taken up a lot of our time, we will start digging into, okay, what can we do to make June 18 through 20 in Orlando a fun time for folks in the LHON community. And I would expect, especially those in the Southeast, we'll have a reason for you to come join us. So that's 2026.
Thank you, Lissa. And just as Chris had shared, talking about a science roadmap, we do have a community roadmap. So kind of still thinking farther ahead to 2027. Lissa, what's ahead?
So since the landscape changed with UMDF, we assessed a variety of options, and we decided that this would be a great time to plan a freestanding LHON only event. And we looked at different opportunities to align with various things that are happening. And we decided, you heard mentioned earlier that there's a group called ARVO, which is like the largest convening of vision researchers in the world. And in early May of 2027, they happen to be convening in San Diego, which coincidentally is where many people on the LHON conference planning team happen to live. So we're taking that as a sign. This is where we are meant to have our first freestanding LHON conference, because we'll be able to get lots of vision researchers who will already be in town meeting to do vision research. And we will then get them to come join us for a little piece of their time. And we won't have to pay all the travel costs. So yeah, cost effective and fun. So we are looking forward to putting something together. It's 2 years down the road, so we have a little bit of time, but just mark that on your calendars that April 20th, May 1, 2, San Diego is going to be a fun place to be. Details to follow.
So fun. That's fantastic. I know we just got started in our 2025 conference, but there's so much to look forward to and so much opportunity from researchers that we'll hear soon, from various volunteer aspects. Coffee and Conversation sounds like it's going to be a buzzing between DCP and all the various vendors that are going to be there. So we're really looking forward to it. But I'll end with the call to action that there's so much still to do. There's so much progress we've made. I'm super proud to be alongside this fantastic team, but there's still more. So my call to action and how I'll leave you today is, if you have a superhero or superpower like everyone was talking about, please raise your hand, come join, come say hello, and share that with us so we can continue to grow as a fantastic community. So thank you all.